Good afternoon. On behalf of the Natrona County Emergency Operations Center, thank you for joining us for today's COVID-19 response news brief. Following today's broadcast, we'll be copying the prepared statements into the text body of our Facebook Live and YouTube live streams. Also, for those joining us online, if you have any questions or concerns, we encourage you to write those in the comments section of the live stream, and we will do our best to answer your questions online as quickly as we can. A couple weeks ago, we announced we were beginning to prepare local facilities to become community medical shelters. As of today, the only facility that has been utilized is the Westwood facility. Right now, EOC community medical shelters are being used to provide shelter for individuals waiting on test results who are in need of a safe place to isolate. Today, we are preparing an additional facility to be used in this same way. The Willard facility, located at 129 North Elk, will soon be ready to welcome members of our community needing a safe location to isolate. As before, right now, neither facility is being utilized to house positive COVID-19 patients. These facilities are for individuals in our community who may have been exposed or are awaiting test results who otherwise are unable to safely isolate on their own. This could be someone who is homeless or someone who lives with at-risk family members and does not want to risk exposure. We are grateful for the support of our community to be able to offer this free voluntary service to those who need it. And we want to continue to extend our gratitude and appreciation to everyone doing all they can to protect themselves and our entire community from the spread of this illness. Thank you. Good afternoon. I'm Haley Bloom with the Casper-Natrona County Health Department. Thank you for joining us today and for your assistance in providing and disseminating up-to-date factual information surrounding coronavirus, otherwise known as COVID-19. Wednesday, we learned of an additional death from COVID-19 in Wyoming. This is our second death within the state. We extend our deepest condolences to his family and friends. As of this morning across our state, there have been 6,427 tests performed, 296 confirmed positive cases, and 187 of those statewide positives have now recovered. As of this morning, 18 Natrona County residents have also now recovered. It's crucial that we continue to do all we can to avoid the spread of COVID-19. We encourage everyone to take the following personal actions. Follow current public health orders, which encourage staying home as much as possible. Stay home when you're sick and avoid contact with other people unless you need medical attention. Follow common sense steps, such as washing your hands often and well, covering your coughs and sneezes, and cleaning and disinfecting. This week, a team from the Centers for Disease Control, or CDC, came to Wyoming to help slow the spread of COVID-19 within the state and local communities. On Wednesday, a team of 5 employees from the CDC in Atlanta arrived. This team consisted of 4 epidemiologists and 1 laboratorian. Epidemiologists are trained to study outbreaks of diseases, causes, locations, and how various communities are affected, utilizing relative information to aid in the prevention of future outbreaks of illness. They also use data to inform evidence-based guidance amidst current outbreaks of illness. The CDC epidemiologists spent 3 days helping with data collection and analysis here in Natrona County, contact tracing, and gathering recommendations on containing the spread of illness in our community. Largely, they visited with and helped plan for containment and prevention in large communal and congregate settings, including skilled nursing facilities, assisted living facilities, and residential treatment facilities. By their nature and populations, these facilities can be hotspots for illness and outbreaks, including COVID-19,
Their assistance has enhanced the tools available to local and state officials to continue to monitor and respond to this illness within our community. Since Monday, the Casper and Natrona County Health Department received confirmation of 5 additional cases. This brings the total to 38 positive COVID-19 cases here in Natrona County. Here's what we know about those most recent cases. Case number 35 is a female in her 20s whose exposure is believed to be related to affiliation with WBI. Case number 36 is a male in his 20s whose exposure is currently unknown. Case number 37 is a male in his 80s whose exposure is currently unknown. Case number 38 is a female in her 20s whose exposure is believed to be related to direct contact with a known positive. In total, there have been 761 tests performed in Natrona County between the main 2 testing facilities of Wyoming Medical Center and the Casper Natrona County Health Department. Of that, 659 were confirmed negative, 38 have been confirmed positive, and we are still pending results for 65 tests. We have mentioned contact tracing often since the beginning of COVID-19 in our community. We wanted to take some time to explain what exactly this is and what it looks like. When a positive case is identified, the Wyoming Department of Health and the Casper and Natrona County Health Department begin contacting the positive case. They ask a series of questions to gather information on travel history, possible places of exposure, and identifying and reaching out to any possible contacts as soon as possible. If someone who is positive had been out and about with others often, they would have many more potential contacts than someone who is largely staying home. As you can imagine, contacts can begin to spiderweb and branch out quickly for individuals who may not be following the recommendations as strictly. This is why it's so crucial for people to adhere to the guidelines of social distancing and staying home as much as possible. Contact tracing can take the team anywhere from 1 to 3 days initially, depending on the complexity and layers of contacts. The additional follow-up with identified contacts can last much longer as contacts are monitored for signs of illness. Our contact tracing teams at the state and local levels are working very hard to complete this as timely and accurately as possible. Currently, the Wyoming Department of Health is considering an exposure as being in direct close contact with someone with COVID-19 when they have symptoms, or during the 48 hours before they develop symptoms to get infected. Close contact includes living in the same household as a sick person with COVID-19, caring for a sick person with COVID-19, being within 6 feet of a sick person with COVID-19 for 10 minutes or longer, or being in direct contact with respiratory droplets from a sick person with COVID-19, which can include being coughed or sneezed on or sharing utensils. Our main health officials in charge of testing in the county said recently that at least half of the confirmed positive cases in Natrona County have been asymptomatic, meaning they showed few to none of the classic symptoms of COVID-19 or had very mild symptoms. This is evidence that even though you may feel fine, you could still be infected with COVID-19 and be contagious to others. There is also evidence that viral shedding, or the exposure of the virus to others through someone ill, can take place days prior to getting symptoms and even days after feeling better. This means that even after feeling better, you should still self-isolate for the length of time recommended by the CDC and Wyoming Department of Health. This includes those who are confirmed positive or those who are expecting they may be ill and may not qualify for testing. Dr. Dowell, our Natrona County Health Officer, said on Wednesday that we have not yet flattened the curve or had substantial improvements in disease. He also stressed that we could be seeing this illness and its effects on our normal lives well into June. Later Wednesday, the governor cautioned people that this was not the time to let up on adhering to the guidelines. We do not think we have seen the worst of this disease yet, and the resumption of life as we knew it before was still a ways away. Currently, the statewide orders are in place are due to expire on April 30th. However, we caution people in thinking that that may be the light at the end of the tunnel and life will return to normal. There is great likelihood that we could see some restrictions or orders of some kind extending well beyond that April 30th date. As a reminder, the number of positive cases is not an accurate description of the amount of disease within the community. We believe there are additional people within Natrona County who are ill or have been ill with COVID-19. These people may not have met criteria for testing, may not have had the means to get tested, or may not be exhibiting symptoms, among other things. As we've stated before, the numbers of positives are likely far higher than we know. The Casper and Natrona County Health Department hotline and the Wyoming Medical Center Respiratory Clinic are still the recommended resources for those experiencing symptoms. The hotline number is 577-9892 and is operating Monday through Friday from 8 a.m. to 5 p.m. Please call ahead prior to arriving at any healthcare facility so appropriate precautions can be taken. We do not want citizens self-reporting to the emergency room. If you're experiencing significant shortness of breath, please call 911. Due to an increase in call volume, if you need help with information, events, or things unrelated to symptoms, you may contact us at covid@cnchd.org. We are responding to emails as quickly as we can. Lastly, we would like to thank you for your ongoing efforts to fight this virus in our community. We know many of you are making substantial sacrifices, including financial ones. We know it is becoming more difficult to continue to remain indoors and away from family and friends. Please stay the course. The sacrifices you are making by staying home and social distancing are making a difference. Thank you.
Good afternoon. My name is Steve Brill, and I serve as mayor for the city of Casper. As we continue to navigate through these unprecedented waters, we are diligently aware and watching how the rest of the world and our country are reacting. We've been following President Trump's discussion regarding the timeline and manner by which the country is looking to begin the process of reopening. We all want to return to normalcy and life as we knew it before this pandemic. As our country begins to think towards the future, Casper and Natrona County are too. As soon as the green light is given to us to start returning to some type of normal, we want to be ready. We are beginning the process of writing a blueprint that outlines plans to reopen businesses and expedite economic activity while continuing to protect our community and slow the spread of the virus. At this time, we do not know what the decision-making process looks like. However, we do believe that whatever decision is made should be one that will take all of us with different points of view working together towards one common goal. We believe that getting solution-based input from our citizens now will help us to write that blueprint. As your mayor, I am inviting our citizens to provide constructive thoughts and ideas on what should be considered in a reopening plan. This plan will likely need to be a phased approach. It will not be a flip of a switch. We will do our best to create a process that maintains the community's health and brings our economy back to life as soon as the appropriate timing and process would allow. Please visit our website at casperwy.gov to submit your ideas. I want to thank everyone in our community for continuing to do all you can to prevent the spread of this illness. We appreciate the immeasurable sacrifices you are making to protect yourself and others. It is still crucial that we practice social distancing and staying home away from others as much as we can. We look forward to working together with you on bringing the community back to life. I will now take any questions anyone may have. Thank you.
Mayor, we have a question from Brendan with Oil City News. Brendan asks, previously you noted that officials have received reports of some businesses not following statewide closure orders. Since that time, have similar reports been received?
To be honest with you, I don't know the amount of reports that have been received. I do know that when they come in, those are reported to law enforcement, and contact is made with those businesses to remind them of what the orders state.
Thank you, sir.
Thank you.
Thank you for joining us for today's Natrona County Emergency Operations Center COVID-19 Response News Brief. You can re-watch this full broadcast on the City of Casper YouTube channel or Casper Natrona County Health Department Facebook page. As we continue to evaluate the best and most effective way to connect with you, we are going to begin releasing information in a more timely way online. This means we will be moving this broadcasted news brief to once a week to take place on Wednesdays at 3 p.m. Other pertinent information will be shared as soon as possible on other days of the week and will be posted on our website, social media outlets, and shared with our media partners for even further distribution. You can keep up with us on Facebook on the Casper Natrona County Health Department's page or visit our website at natrona.info. We would like to thank our media partners for their around-the-clock service to our community in helping to distribute information. And thank you to all of you joining us for these news briefs. We appreciate you. Our next news brief will be on Wednesday, April 22nd at 3 p.m. Until then, please keep yourselves and your families healthy and safe. Thank you.